The kidneys are small organs, but their impact on our health is immense. Did you know that kidney diseases are among the leading causes of death worldwide? Even more alarming is that 90% of people don't know they have a problem until it's too late. In this video, you'll discover the 8 strange signs that indicate your kidneys are crying for help. Don't miss this essential content for your health. Our kidneys, located on both sides of the lower back, are living filters. Every day, they process about 50 gallons of blood, removing toxins, excess water, and metabolic waste through urine. But besides being a sort of waste treatment plant, they perform other crucial functions. 1. Maintain the balance of minerals such as calcium, sodium, and phosphorus. 2. Help regulate blood pressure by releasing the hormone renin. 3. Activate vitamin D, essential for strong bones. 4. Produce erythropoietin, a hormone that stimulates the formation of red blood cells. However, when something starts to go wrong with the kidneys, these functions are compromised. The most alarming part is that kidney diseases are often silent in their early stages, with symptoms that go unnoticed or are mistaken for minor health issues. Although kidney failure symptoms can be subtle, detecting them early can make the difference between preserving your quality of life or facing irreversible damage. In this video, we'll examine each of these signs so you can take action before it's too late. First sign: changes in urine, foamy or bloody urine. Changes in the frequency, color, or texture of your urine are one of the most reliable indicators that your kidneys might be in trouble. Have you noticed foam in your urine? This could be a sign of protein leakage caused by damaged kidney filters. On the other hand, the presence of blood, known as hematuria, may indicate infections, kidney stones, or even tumors. The most common signs include: 1. Foamy or bubbly urine. Similar to whipped egg whites, this is caused by the presence of albumin, a protein that should remain in the blood. 2. Discolored or bloody urine. A brown, red, or purple tint can signify serious problems. 3. Changes in urinary frequency. Frequent urination, especially at night, or the feeling of not fully emptying the bladder. Constant fatigue in the kidneys. Have you been feeling extremely tired lately, even after getting enough sleep? Persistent fatigue is a sign often overlooked or attributed to daily stress, but it could indicate something wrong with your kidneys. In this segment, we'll explore how these organs, when not functioning properly, can deprive your body of the energy needed to carry out basic tasks. Our kidneys play a key role in removing toxins from the blood. When they stop filtering efficiently, toxins and waste products start to build up in the body, a condition known as uremia. This excess of impurities directly affects your energy levels, causing weakness, dizziness, and even difficulty concentrating. Additionally, the kidneys produce an essential hormone called erythropoietin, EPO, which stimulates the production of red blood cells. These cells are responsible for transporting oxygen throughout the body. Without enough oxygen, tissues and organs cannot function optimally, resulting in a constant feeling of exhaustion. How to identify fatigue caused by kidney problems? Kidney-related fatigue isn't the typical tiredness you feel after a long day. Here are some characteristics to help you recognize it. 1. Unexplained exhaustion. Even after a restful night's sleep, you feel you don't have the energy to start your day. 2. Difficulty performing simple tasks. Everyday activities like showering, walking short distances, or climbing stairs may feel like a challenge. 3. Dizziness and difficulty concentrating. A lack of oxygen due to reduced red blood cells can make you feel disoriented or have a foggy mind. 4. Unusual paleness. A decrease in red blood cell production may also manifest as paler skin than usual. When the kidneys fail, erythropoietin production decreases drastically, leading to anemia. This condition not only worsens fatigue but can also cause extreme weakness and muscle fragility. In some cases, individuals with advanced kidney problems feel so drained of energy that they are unable to get out of bed or perform any physical effort. If you notice that this exhaustion is persistent and doesn't improve with rest, it's important to take action. Getting a blood test to check creatinine and hemoglobin levels can help identify kidney problems before they worsen. Additionally, consider a comprehensive kidney function test to evaluate your kidney's overall condition. Swelling in the body. Have you noticed that your feet, ankles, or even your face seem more swollen than usual? This symptom, known as edema, could be a sign that your kidneys are not functioning properly. Swelling in the body is a clear indication that your body's fluid balance is compromised. In this section, we'll explain how to identify this issue and what causes it. Why does swelling occur? The kidneys play a crucial role in regulating fluids in the body. When they are not functioning properly, excess fluid and sodium start to build up in the tissues. This imbalance causes visible swelling, especially in areas like the ankles, feet, hands, and even under the eyes. Additionally, the kidneys are responsible for maintaining adequate levels of albumin, a protein that helps keep fluid inside the blood vessels. If the kidneys lose too much albumin due to damage in their filters, this fluid begins to leak into surrounding tissues, causing inflammation. The location of the swelling can give you clues about its cause. 1. Ankles and feet. This is the most common site for edema, especially if you spend a lot of time standing or sitting. 2. Hands. You may notice your rings feel tighter or that you have difficulty fully closing your hands. 3. Face. Swelling under the eyes, known as bags, can be an early sign of protein loss in the urine. 4. Legs. In more advanced cases, fluid retention can spread to the legs, making them feel heavy or tight. Distinguishing kidney-related swelling from other causes, it's important to note that swelling is not always caused by kidney problems. It can also result from liver diseases, heart issues, or even vein disorders. However, if edema occurs along with other symptoms like changes in urine, fatigue, or high blood pressure, it's more likely related to your kidneys. Another key point is that kidney-related swelling may not go away easily, even if you elevate your legs or reduce salt intake. This is because the underlying problem lies in the kidney's functionality, not just sodium consumption. If you experience persistent swelling that doesn't improve, it's crucial to seek medical attention. Blood and urine tests can reveal whether your kidneys are functioning properly. Additionally, a kidney ultrasound can help identify structural issues or fluid accumulation in these organs. Doctors often recommend measures such as reducing salt intake, staying hydrated, and in some cases, using diuretic medications. However, these solutions are only palliative if the underlying problem is not addressed. Difficulty breathing. Do you frequently feel short of breath or notice that climbing a few stairs leaves you exhausted? Difficulty breathing, medically known as dyspnea, is a symptom many people associate solely with heart or lung problems. However, it can also indicate that your kidneys are not functioning as they should. In this section, we'll explore how kidney problems affect your breathing and why this symptom should not be ignored. How do kidney problems cause difficulty breathing? When the kidneys fail, they cannot efficiently eliminate excess fluid from the body. This fluid can accumulate in the lungs, a condition known as pulmonary edema, making it harder to breathe. Excess fluid in the lungs can make simple activities like walking, talking, or even lying down uncomfortable. Additionally, the kidneys play a fundamental role in producing red blood cells through the hormone erythropoietin, EPO. When red blood cell levels decrease, oxygen supply to the body's tissues is also affected. This lack of oxygen can cause extreme fatigue and shortness of breath, even while resting. Signs of kidney-related breathing issues. Dyspnea associated with kidney problems can manifest in different ways, depending on the underlying cause. 1. Shortness of breath while lying down. Difficulty breathing while lying flat can indicate fluid buildup in the lungs. 1. This can become so severe that some people need to sleep in a semi-sitting position to relieve discomfort. 2. Breathlessness during physical activity. If everyday activities like walking, lifting light objects, or climbing stairs leave you out of breath, it may be linked to reduced oxygen transport due to anemia. 3. Persistent cough or chest pressure. These signs, combined with difficulty breathing, may indicate pulmonary edema and require immediate medical attention. When is it an emergency? Shortness of breath can be a serious symptom if accompanied by other signs such as 1. Chest pain. 2. Dizziness or fainting. 3. Worsening breathlessness. In such cases, it is crucial to seek immediate medical help. Blood tests, imaging studies such as chest X-rays, or kidney ultrasounds can help identify the cause of dyspnea. Although the definitive solution depends on the cause, here are some measures that can temporarily relieve symptoms. 1. Limit fluid intake. This can help reduce fluid buildup in the body. 2. Follow a low-sodium diet. Avoiding salt can decrease fluid retention and improve kidney function. 3. Consult a doctor. If dyspnea persists, a specialist may prescribe diuretic medications to remove excess fluid or treat anemia if present. Dry and irritated skin. Have you noticed your skin is drier than usual or that you constantly feel uncomfortable due to inexplicable itching? While this symptom might be associated with common issues like allergies or dry weather, it could also be a sign that your kidneys are struggling to perform one of their most important functions, maintaining the balance of minerals and toxins in the body. In this section, we'll explore how kidney problems can manifest in your skin and why this symptom shouldn't be ignored. The kidneys not only filter toxins from the body but also help balance levels of minerals like calcium and phosphorus, which are essential for bone and skin health. When the kidneys fail, these minerals can build up in the body, triggering adverse skin reactions. Additionally, the accumulation of toxins in the blood can cause persistent itching, known as uremic pruritus. Another critical factor is that the kidneys help maintain proper hydration levels in the body. When they aren't functioning correctly, the skin can become dry and rough due to a lack of adequate hydration. Characteristics of kidney-related dry and irritated skin. 1. Persistent itching. The itch can be intense and unresponsive to common topical treatments. 1. It may be localized or spread across the body. 2. Changes in skin texture. The skin may become scaly, rough, or show a yellowish or brownish tone due to toxin accumulation. 3. Hypersensitivity. Some people experience heightened sensitivity to touch, making even light pressure on the skin uncomfortable. 4. Lack of elasticity. The skin may lose its natural elasticity, appearing dull and prematurely aged. Although dry skin might seem like a minor issue, it's a sign that the kidneys aren't properly regulating the body's internal balance. This dysfunction may also be associated with elevated phosphorus levels in the blood, potentially leading to more severe complications like bone weakness or calcium deposits in soft tissues. Moreover, kidney-related skin issues are often persistent and challenging to treat with conventional methods, underscoring the need to address the root cause. If you suspect your dry or itchy skin is linked to kidney problems, consider these measures. 1. Consult a doctor. Blood tests can determine if your phosphorus, calcium, or creatinine levels are out of range. 2. Moisturize your skin. Use hypoallergenic moisturizers and avoid products that could further irritate your skin. 3. Follow a balanced diet. Reducing intake of phosphorus-rich foods, such as dairy products or processed meats, may alleviate some symptoms. 4. Stay hydrated. Drinking adequate amounts of water can help improve both kidney function and skin hydration. Metallic taste in the mouth and bad breath. Have you ever felt like food tastes strange, as though everything has a metallic flavor? Or do you notice your breath has an unpleasant odor, even after brushing your teeth? These symptoms, though seemingly harmless, could indicate that your kidneys aren't functioning properly. In this section, we'll explain why these problems occur and how they are related to the buildup of toxins in your body. When the kidneys fail, they cannot adequately filter waste and toxins from the blood. One such waste product is urea, which begins to accumulate in the body. This excess urea can break down into ammonia, causing a metallic taste in the mouth and a foul-smelling breath known as uremic breath. Additionally, this toxin buildup can affect taste buds, altering the way flavors are perceived. As a result, many people with kidney issues lose their appetite or develop an aversion to certain foods, particularly meats and sweets. Signs your kidneys might be struggling. 1. Persistent metallic taste. This taste doesn't go away, even after rinsing your mouth or brushing your teeth. 2. Loss of taste. Foods you once enjoyed may seem bland or unpleasant. 3. Foul-smelling breath. A smell similar to ammonia may be constantly present, regardless of your oral hygiene. 4. Nausea or vomiting. Toxin buildup can cause stomach discomfort, worsening appetite loss. The metallic taste and bad breath not only affect your relationship with food but also your confidence in social interactions. These symptoms are often ignored or attributed to dental issues, yet they may be early indicators of chronic kidney failure. Furthermore, the appetite loss caused by these symptoms can lead to unintentional weight loss and nutritional deficiencies, worsening overall health and accelerating kidney damage. If you notice a persistent metallic taste or bad breath that doesn't improve with good oral hygiene, take action. 1. Consult a doctor. Blood and urine tests can identify elevated urea levels and other indicators of kidney problems. 2. Maintain good oral hygiene. While it won't solve the underlying issue, it can help reduce discomfort. 3. Avoid processed foods. Foods high in sodium or additives can worsen toxin buildup in the body. 4. Follow a low-protein diet. Consuming excessive protein can increase urea levels in the blood. 4. A nutritionist can help you plan an appropriate diet. Sleep problems. Have you spent nights tossing and turning, unable to fall asleep? Sleep problems are a common complaint in modern society, but when this difficulty is combined with other symptoms, it could be a sign that your kidneys aren't functioning properly. In this section, we'll analyze how the kidneys affect sleep quality and why it's crucial to pay attention to this symptom. The kidneys play a vital role in removing toxins from the body. When they don't function efficiently, these toxins accumulate in the bloodstream, creating a general sense of discomfort that can make sleep difficult. Additionally, imbalances in the body's fluids and minerals may cause physical symptoms that disrupt rest, such as nighttime muscle cramps or a feeling of bloating. Another critical factor is the connection between kidney problems and sleep disorders, such as sleep apnea. This condition is characterized by repeated interruptions in breathing during the night, which not only affects rest but can also worsen kidney health due to reduced oxygen levels in the body. If your kidneys are at risk, you might experience one or more of the following sleep-related problems. 1. Persistent insomnia. Difficulty falling or staying asleep throughout the night. 2. Morning fatigue. Feeling exhausted and low on energy despite sleeping for several hours. 3. Sleep apnea. Episodes where breathing momentarily stops during sleep, often accompanied by loud snoring. 4. Nocturnal cramps. Muscle spasms in the legs that interrupt your rest. 5. Frequent urination. The need to wake up multiple times during the night to urinate, known as nocturia, can disrupt your sleep. Lack of sleep not only impacts your mood and daily energy levels but also has long-term consequences for your health. Without adequate rest, the immune system weakens, making it harder for the body to fight infections. Additionally, untreated sleep apnea can lead to high blood pressure and cardiovascular damage, further worsening kidney health. If you suspect your sleep problems are linked to kidney health, here are steps you can take. 1. Consult a specialist. A doctor can perform tests to determine if your sleep issues are related to your kidneys. 1. Tests such as creatinine analysis and sleep studies can be helpful. 2. Maintain a sleep routine. Try to go to bed and wake up at the same time every day to regulate your biological clock. 3. Monitor fluid intake before bedtime. This can help reduce nighttime urination and improve rest. 4. Follow a balanced diet. Limiting sodium and processed foods can ease the strain on your kidneys and improve overall health. 5. Engage in regular exercise. Moderate physical activity can help you sleep better, though it's best to avoid exercising right before bedtime. High blood pressure and diabetes. Did you know that high blood pressure and diabetes are two of the leading causes of chronic kidney disease worldwide? These conditions, which affect millions of people, not only increase the risk of kidney damage but can also result from kidney problems. In this final section, we'll explore the connection between these diseases and the kidneys, as well as how you can protect your kidney health if you have either of these conditions. The kidneys are responsible for filtering blood and maintaining fluid balance in the body, functions that depend on a steady and consistent blood flow. However, when blood pressure is too high, the small blood vessels in the kidneys, known as glomeruli, can become damaged. This damage reduces the kidney's ability to filter waste and toxins effectively. In addition, high blood pressure is not only a cause of kidney disease, it can also be a consequence of kidney problems. When the kidneys aren't functioning properly, they may release hormones that raise blood pressure, creating a vicious cycle that accelerates the deterioration of these vital organs. Diabetes and its impact on the kidneys. Diabetes is another condition closely linked to kidney health. Elevated blood sugar levels damage the small blood vessels in the kidneys, impairing their ability to filter waste. This progressive damage can lead to a condition known as diabetic nephropathy, one of the leading causes of kidney failure worldwide. The most common signs of kidney damage in people with diabetes include 1. Presence of protein in the urine, albuminuria, an early sign that the kidney filters are damaged. 2. Increased creatinine levels in the blood, a key indicator of kidney function. 3. Swelling in the feet and ankles, related to fluid retention due to declining kidney function. How to prevent kidney damage if you have high blood pressure or diabetes? The good news is that with proper management, the risk of kidney damage can be significantly reduced. Here are some recommendations. 1. Control your blood pressure. Keep your blood pressure below 130/80ths of a millimeter of mercury. 1. A doctor may recommend specific medications to protect the kidneys, such as angiotensin-converting enzyme inhibitors, ACE inhibitors. 2. Monitor your blood sugar. If you have diabetes, maintaining blood glucose levels within the target range is crucial. 2. This can be achieved through a combination of diet, exercise, and medication. 3. Schedule regular checkups. Urine and blood tests to measure albuminuria and creatinine are essential for detecting kidney issues in their early stages. 4. Reduce salt intake. A low-sodium diet can help control both blood pressure and the strain on the kidneys. 5. Avoid medications that harm the kidneys. Some pain relievers and anti-inflammatory drugs can worsen kidney damage, especially if used excessively. 5. Always consult your doctor before taking medications long-term. High blood pressure and diabetes are conditions that, if left unmanaged, can cause irreversible kidney damage. However, with lifestyle changes and constant monitoring, it's possible to keep your kidneys healthy and prevent severe complications. Remember, your kidneys are vital for eliminating toxins and maintaining your body's balance. Taking care of them is taking care of your life. We've reached the end of this important journey through the 8 strange signs that your kidneys are calling for help. Detecting these symptoms early can make the difference between preserving your kidney health or facing irreversible complications. If you found this video helpful, don't forget to give it a like and share it with your loved ones. Together, we can raise awareness about the importance of kidney care. Thank you for joining us, and we'll see you in the next video. This video is for informational purposes only and does not replace professional medical advice. Always consult your doctor for specific guidance tailored to your situation.